So starting this morning, Nigerian nurses don't go on strike, right? They complain about many things with federal government they do them. The strike is going to be a 7-day strike. It's not indefinite. It's called a warning strike. So they're not a strike today. They just want strike for 7 days to take one government. They are demanding some things when government never gives them. Let me show you this news according to Premium Times. Nigerian nurses will commence a nationwide strike today to demand improved welfare, fair allowances, and better working conditions for nurses. The National Association of Nigerian Nurses and Midwives said the strike action became necessary after a 15-day ultimatum issued on the 14th of July expired without a meaningful response from the federal government or the Federal Ministry of Health. The strike starting 12 midnight on Tuesday, July 29, will involve total service withdrawal across all federal health institutions. Nurses nationwide have been asked to comply fully and stand in solidarity with the union, the union said in a Monday statement. The 7-day warning strike is expected to end on the 5th of August. It will involve nurses in public health institutions across the country and is expected to impact health services in public hospitals. The NANNM reaffirmed nurses' central role in healthcare delivery. It said its members contribute 60 to 70% of hospital services and so deserved improved welfare, fair treatment, and recognition for their essential services. It rejected a 27 June circular from the National Salaries, Income and Wages Commission and demanded adjustments to various allowances, including shift, core duty, and retention. State chapters of NANNM have already indicated their willingness to join the strike. The Union Secretary in Oyo, Emmanuel Aino, said in a statement that nurses in Oyo will join the strike. He said the strike action followed the resolution reached at an emergency meeting of NANNM, National Executive Council, and subsequent directive from the national headquarters. I write to notify you all that all nurses and midwives across all healthcare institutions, federal, states, and local governments are directed to embark on a 7-day warning strike. The strike is scheduled to commence at midnight on Wednesday, July 30th, and will run through August 5th, 2025. The statement read. Mr. Aino urged full compliance, adding that official communication regarding the union's 8-point demand had been sent to relevant authorities. This 7-day warning strike is a litmus test for our readiness to pursue a more serious struggle if our demands are not addressed, he said. Mr. Aino said that among the union's key demand is the implementation of new minimum wage for nurses and other staff at Lautech Teaching Hospital, Ogbomoso. He added that the union was also calling for the payment of uniform allowances to all nurses and midwives in the service of Oyo State. In accordance with public state service rules, other key demands include mass recruitment of nurses and midwives into the Hospital Management Board and Lautech Teaching Hospital to address severe staffing shortages. But if we not be crazy people for this country, is this supposed to be a topic for discussion? Are we supposed to be discussing salaries of nurses and welfare? Shortage of nurses, that the nurses has to go on strike for us to recruit more people, for us to pay them well, for us to take care of them. Is this supposed to even be a discussion? And we're taking of House of Assembly members. We're taking of senators. We're taking of politicians. Is Nigeria built for politicians? For Christ's sake, nurses, doctors, police, and teachers, army should not even be talking about low salary. So now federal government approved minimum wage of 70-something thousand to even pay the money safe now war. Now they are going to go on strike in the federal hospitals and the state hospitals. It no go affect rich man. Now poor man children go suffer. Because these politicians now they don't even treat themselves for Nigeria in the first place. People will get smoked, we don't get 10-20 million, then they go government hospital. Now poor man I go suffer and it will not shake the government. As private as a government could go on strike for Abuja, so now yes, we can answer them. I think these people are targeting the wrong places. They are targeting the wrong places. If you want politicians to respond, don't target the poor people, not concern politicians.